So I found the answer, and it is that the Occupational Safety Health Administration, OSHA, requires employee training programs for newly hired dental personnel who may come in contact with bloodborne pathogens, saliva, or other potentially infectious materials. Dental personnel whose job description changes and are at risk for coming in contact with potentially infectious materials should also be trained. The employer is required to maintain records of all training. Now listen, I would do for your CEs though once a year an infection control. The test says newly personnel, which I understand, but I would definitely get that done for your CEs. Let me go back to the questions. We are almost done with this video. Like I said, it's a lot to study, but I hope this video has helped you guys. Just a couple more questions. Hazardous materials utilized in a dental office must be A. Labeled properly with biohazard warning symbol. B. Label and identify in 3 different languages. C. Store in the refrigerator. D. Store in a locked file cabinet. So hazard materials utilized in a dental office should be A. Labeled properly with a biohazard warning label, okay? And they got stickers that you can get with your MSDS book, and you can label anything that doesn't have labels on it. You have to do that in case OSHA walks in. It's a violation. A lot of people don't know about OSHA's rules. 19. Steam under pressure autoclaving is best suited for A. So this is a question. Steam under pressure, which is the autoclaving, is best for A. Paper or plastic products. B. Nitrous oxide rubber hoses. C. Non-corrosion metal instruments. D. Handpieces. The answer is D. Non-corrosion metal instruments. So autoclaving is great for non-corrosion of metal instruments. 20. Flushing dental unit water lines is recommended. A. For 30 minutes at the end of the workday. B. Between patients if transmissible disease exists. C. For 30 minutes at the beginning of the workday. D. At the beginning of the workday and between patients. So once you flush the water lines, it's D. At the beginning of the workday, because it sat there all night, and then between each patient. Make sure you have time for that. Okay, before I end this lovely lecture, some of you guys might have fell asleep through or just fast forward through it or skipped the video. For those that stuck around, thank you so much. Like I said, I am doing this for you guys. And I have 2 books I want to show you. This is the one that I studied for, like morning, noon, and night. And if you're studying for your CDA, it has, let me just show the ones that I printed out. It has a practice exam that you can do, and I have printed me out copies, and you just study it and take the test. And then the other book that I was using, I just lost it. Because I need this book. What's this? Complete Review for Dental Assistants. And this one has a disc in the back that I have in my book bag from the school, and it shows pictures and stuff like that. So I'll put both links for you guys. How to mount x-rays, occlusal x-rays, I mean the anatomy. They're both awesome, but this is the one that I actually use to study morning and night. So and it has the answer key for you. Alright, plus I'm going to upload the slides so you can follow along and just study for your radiation health safety exam, including your ICE exam. But let me go over some things real quick. So remember, anything that is sharps goes in a puncture resistant container. There are things that are disposable that need to be disposed. There are some things that can be cold sterilized for up to 10 hours to sterilize, 10 minutes to disinfect. Semi-critical instruments you need to wipe down. Alright. Your impression trays. Impressions you need to disinfect before sending to the lab. Before you're polishing your temporary, make sure you disinfect that and rinse it well before putting in the patient's mouth. You need to have your disposable suctions, and always get a cup of water or some solution and run the line through when you're doing bloody procedures to keep it before you take it off or you get blood on you. Remember that your endo files are sharps container worthy once they are bent. And remember to seal your bag, and most importantly, switch your tips out here. Always bleed them before giving it to the dentist to make sure the lid is on and that they're not stuck. Make sure you check the health history to make sure they're not allergic to anesthetics, red dye number 4 for topical, or the rubber dam latex. And for you guys, welcome to the dental field, and make sure that you don't wear your gloves too tight. You're there for the patient, and the patient's only there for an hour. So when you're alone with the patient or with the doctor and you see the doctor struggling, speak up for the doctor and just say, please lift your chin, you know, so we can see better. Turn your head to the right or turn your head to the left. Make a move for a little bit. They're just there for an hour. You're there 8 hours. Learn from me. I always babied my patients, which is great. Vaseline on the corner of the lips, you know, tuck their bib, fold it so it's not rubbing their neck, cut the rubber dam for them so they can breathe out their nose, you know, wipe their face if they're getting dirty, give them safety glasses, give them a blanket if they need it, but take care of number one. You can't take care of your dentist. You can't take care of your family if you're not feeling well. And learn from me, okay, because I am suffering some days. I hurt. I used to hold heads at an office and for pediatrics for the kids so they wouldn't jerk, and I've really messed up my back so bad to where I will literally have to stop so I won't scream in pain. So please raise that chair up if you're a tall lady, lower it down if you're a shorty like me, okay? Take care of yourself. And your mask, remember, the electric surge can do the ear saw and can go in here. The high-speed handpiece, if you run it like this, can get down in here. If you do the figure 8, it can get in the hole right here, okay? So make sure that you have it normal. You have your hair back with a clip. If you feel like you're going to sweat, you know, I start wearing like a Motley Crue look, which some of my other students have done too. And you wear a little sweatband right here. If you get hot, wear the sleeves. I have them on my page where it just covers your arm. Take them off at lunchtime. And just do your best. If you pass this exam and I've helped you with that, please share with me. It keeps me motivated and keep me going. I'm semi-retired. Let's see here. Don't forget about the mouth rinses before procedures. That will help with keeping the bacteria down. And that's it. Alright guys, don't forget to like this video and subscribe for more updates. And if you're thinking about making extra money on the side, if you have a hobby with jewelry or animals or something, or your spouse has a business, I put some links down below for how you can do your own webpage, okay guys, or make your own YouTube video on something. For now, take care. Keep me posted. Good luck and bye.